Hello everyone, my name is Rivky Weiss and I'm going to be doing a live on KAP, Ketamine Assisted Psychotherapy. Some of this may be overlapped with a discussion on psychedelics as a whole. So this is actually the second installment of this series, and some basic questions and a more thorough explanation of what KAP is was discussed in our first live. So feel free to go back and watch that to get some more background information. So just to quickly recap, when we say psychedelic therapy, ketamine is the only legal psychedelic that's currently legal to be used in therapy in New York. Some of this varies state by state. Some other states have been using different psychedelics. But for the sake of our live, and most of what we're going to be discussing today is going to be about ketamine. This live is going to be in a question and answer format. So based on some questions that different followers have submitted. So when I say KAP, it means Ketamine Assisted Psychotherapy, which means combining ketamine together with therapy in the session. And most of the questions that I'm going to be answering are going to be using that lens. It's a little different than just using ketamine at a clinic, which I discussed in a previous live what the differences are. So one of the questions that came in is, at what point does one decide to consider psychedelics? I'm in therapy and on meds, and I'm not seeing results I really want to see. So we discussed a little bit of this in the previous live, but I'm going to respond to it again because it's a question that I get asked often. So it's important to keep in mind that ketamine is a very intense form of therapy. It's also a couple of hours. So some might say it's not that different than doing 2 or 3 hours of any type of modality. Some people do EMDR for 3-4 hours, or somatic therapy intensely for 3-4 hours, or IFS for a double or triple session. If anyone has ever tried having a double session, then they will recognize that it's much more intense. So one of the things to consider is cost, because obviously something that takes 4 hours will cost more and take more time. Can also make you feel a little bit more dysregulated because you're really getting deeper into whatever it is that's going on. So ketamine is something that you can consider based on, obviously discuss it with a therapist that you already have and that you're seeing. It's expensive and it takes a lot of time, but the question is also, whatever the issue that you're having in your life, what price are you paying for that? Is it your job, your relationship? Have you spent a lot of time and money in ineffective treatment? Is it affecting, what areas of your life is it affecting? And that's going to help you make the decision of cost versus benefit. The next question that came in is, what are the good and bads of psychedelics? So I'm going to be answering this question more specifically towards ketamine because that's what I trained in. Also, there isn't that much research surrounding other psychedelics like ayahuasca or MDMA, which have not been approved by the FDA. So what we know is anecdotal, but there hasn't been a lot of research published. I actually see a question coming in of what is ketamine. Ketamine is a psychedelic that's been FDA approved to be used in therapy. It's a drug. Psychedelics include common ones like LSD, ayahuasca, MDMA, and psilocybin, which is mushrooms. In the previous live, as I mentioned earlier, I discussed more of what it is, what it does, and what it means. So back to the question of what are the goods and bads of psychedelics. So obviously, some things that we've known and research has shown is that it can be extremely effective in ways that therapy without this medicine cannot be. Yes, it's coming at it from a much stronger perspective, but people also see results. It's probably for most people, it's not the first therapy they will try. They've tried other things before. For example, treatment-resistant depression they've already tried medication and other types of therapy, and it hasn't worked. For people with suicidal ideation, they have tried DBT or other therapy programs and haven't seen success. For PTSD, most people that will attempt to use ketamine have already tried EMDR, somatic therapy, and other types of therapy and have not been successful. So ketamine is usually not the first thing you try, but it has been, there's a bunch of studies out there that have shown it to be very effective. Studies on treatment-resistant depression have found that between 70 and 80% of people have reported feeling much better. I don't have the numbers offhand of the people who have extreme suicidality and have not been able to find relief in any other way. But the numbers are promising, and the numbers are showing that people have been feeling relief. So what is the bad of psychedelics? So when I talk about using ketamine, I'm talking about using it in a therapist's office with support and with someone who's with you. Obviously, people that do things recreationally or do it at home can have a different experience. But one of the downsides of ketamine or psychedelics or ketamine, in ketamine it's called the K-hole, and that's kind of when somebody feels extremely dissociated and out of touch with their surroundings and they start panicking and feeling terror. If you're doing this with somebody who's trained, then they can help bring you out. Usually it's by eating or drinking something sweet like apple juice or candy or something. But there are no long-term effects. It might feel terrifying in the moment, but there are no long-term effects. There are some physical side effects that can happen, and this is why somebody needs to be cleared medically. People that are at risk for high blood pressure or have issues with their bladder may not be a good candidate for ketamine. Next question that has come in is, how soon do you notice an improvement when using psychedelics on your journey? So this is a difficult question to answer, but there's been a lot of research about it. So I think it also depends on what your goal is for doing ketamine and what you're trying to achieve. Most of the studies that study how soon you can expect to see results are those that are studying the treatment-resistant depression. So some people have responded within minutes and reported immediately feeling better or even feeling better on their journey and carrying that feeling with them for the next few days. Some people have found that they started feeling better a day or two later. And then other people have found that by the second or third session of ketamine, they've started feeling better. By the third or fourth time of doing ketamine, especially for something like treatment-resistant depression or suicidality, if it hasn't been effective, then it's not going to work anymore. Then you know that it's not going to be effective. But most people have definitely responded after the third session. Otherwise, it really varies on a person-by-person basis, on their metabolism, on what else has been going on, what other therapy they've combined it with. So the next question that's come in is, how do psychedelics affect consciousness and perception, and are they safe? So again, I'm going to answer this question based on ketamine because I'm not trained in other psychedelics, as I mentioned before, and also they haven't been FDA approved. So ketamine has been used since about 1970 as an anesthesia, and we've only recently been using it as a psychedelic. So it's really been on the market for more than 50 years. And it's been considered safe to use in adults and children. So the FDA is not concerned about safety. So as to the first question is, I'm going to answer it as, how does ketamine affect the body? So ketamine starts its effects in the body pretty quickly after it's taken, depending on the form of ketamine, if you're doing the injection, IV, or the sublingual one that goes under the tongue. Generally between 3 to 15-20 minutes, depending on the compound, the pharmacy, and all of that. But you start feeling it pretty much right away. Most people will metabolize it anywhere between 45 minutes to an hour, 2 hours, depending on the dose and your metabolism. So what actually happens in your body? So physically, a person might experience elevated heart rate. They don't feel their body. They feel like they're floating. Some people might feel nauseous and a little dizzy. Neurochemically, ketamine causes changes in your vision and neuroperception. So some people have a hard time remembering what they experienced in their journey. Even people that are talking and describing what they're seeing may not have a memory of what they mentioned afterwards. How does ketamine affect the mind specifically? So Some people can feel euphoric, relaxed, dissociated, or even like in a trance. It almost takes you on another level of consciousness. And people might be seeing different colors, sounds, visions. Some people experience what practitioners like to call an ego dissolution, which almost feels like they cease to exist and they're just floating in the universe. That usually happens in pretty high doses. So it's almost like a mystical experience where there's, depending on the person and their journey, but people can experience very different types of, they feel like they're floating. They might feel like sometimes it's an out-of-body experience. You can feel like you're in a different planet, different universe with different people, seeing different things, hearing different things. And it's important to be prepared to that and to expect it. You're not going crazy. It's all normal. But this altering experience is what makes it effective. So another thing to keep in mind is ketamine's effect on the body. So as most of us know, trauma is stored in our mind and in our body. Our body also carries the trauma with us. And sometimes when we're triggered, our heart rate goes up, or we start panicking, or we don't feel safe. In order to do that, a lot of people cope by going into their brain, using their logic, and kind of move away from those sensations and try to make sense of what's going on. Sometimes people will distract themselves, work a lot, or do other things so they don't feel these sensations. So during a ketamine experience, again, everybody's experience is individual, but many people have reported feeling like they're floating. They can like touch their hands or touch their legs or touch their face, but it almost feels like it's somebody else. Your body definitely feels weightless, which is why a ketamine session is usually done on a couch or in a recliner where you can lay down. So this separation from your body's sensations is very helpful in a ketamine journey and in the healing process, because if anything gets activated, like your body is not getting activated, which allows you to remember things in a different way. You're basically creating new neural pathways, and instead of doing the same patterns that you're used to doing, you're doing something a little different. And this whole experience of feeling out of your body, of an alternate reality, of things not being the way you usually see them, it's like this different level of consciousness, has been shown to activate the inner healing intelligence. So in many different therapy modalities, we believe that every single person has an inner healing intelligence. We have the ability to heal ourselves. The same way when we cut ourselves or we get any type of wound, you break a bone, sometimes you need stitches, but your body has a way of creating new cells and healing itself. So too can our mind and our psyche. So when entering a journey on ketamine and entering this alternate state of consciousness, it activates our inner healing intelligence and allows that to take over. Another question that has come in is, does ketamine, this is specifically for treatment-resistant depression, does this replace my antidepressants? And not so specifically to any other medication. So the answer is that while doing ketamine treatments, you usually do not discontinue medication. You will take that in addition, and over time, once you start feeling better, then you can wean yourself off your medication. But we want to leave things as they are, continuing with your regular therapy and your regular medication until you finish the ketamine regimen. The only thing is that there are certain medications that counteract with ketamine that you may not be able to take the morning of a session, but you will resume taking it the day after. So what are the most common side effects of ketamine is another question that has been coming in. The most common side effects are dizziness, nausea, and sometimes fatigue. So it's difficult for a person to know how they're going to respond. One of the ways that can give you a hint is if somebody often has motion sickness when they're in a car and they usually get very nauseous driving, then they may assume that they'll get nauseous while on ketamine. it's not a guarantee. Some people choose to have a ketamine session and see how they respond and what that's like, and then they know. One of the ways to counteract the nausea is to take a Zofran. Whoever prescribes ketamine usually prescribes a Zofran along with it. As for dizziness, some things that have been shown to help is getting enough sleep before and eating healthy, and also like coming out of the journey. As we've discussed in our previous live, most people tend to wear eye masks to prevent dizziness, but to take their time coming out of it, take their time sitting up, and then eat something, which usually can help prevent that a little bit. Can I eat or drink before my appointment? Ketamine needs to be taken on an empty stomach, specifically because of the nausea side effect, but also because sometimes in an altered state, there's a worry that you may not be able to swallow, or if any food comes up that you might be unaware of it. So fasting about 3 to 4 hours before a ketamine session is the standard. Another question that people often have is, can I return to work? How will I feel? What to expect afterwards? So this is a very individual thing, and everybody's different. Definitely it takes a little bit of time to fully come back to yourself, and some of this you might already know if anyone has ever had any surgery or any type of procedure where they had general anesthesia. That might give them a little bit of an inkling of what they'll be like. Again, we're not talking about ketamine on such heavy doses, so it's not the same experience. But people that are generally a little dizzy or nauseous after any type of anesthesia can expect that this might happen again to them. But again, it's a much lower dose. So generally, we do not allow people to drive home after a ketamine session. We ask that they have somebody pick them up, or maybe take an Uber if somebody's waiting for them at home, just because you want to be safe and make sure that they're not still under any type of effect. By the next day or a couple of hours later, the effects are gone, the ketamine is already metabolized, and you should be good to go. Some people, though, continue processing for a day, 2, or even 3 days, and they might need to take a little easy and to relax their schedule a little bit. That's something to also consider when thinking about if ketamine therapy is right for you, is if I need to take a little time off, or I need to take off a day off from work, or I need a little help with childcare, can I do that? Is that set up for me? It's also something to consider before you start. Another question that often comes in is, some of you might be aware, ketamine has also been used as a street drug. In the past, it's called Special K or just K. And the question is it addictive? So, like any drug, yes, it's addictive, but it's also been shown to be a lot less addictive than other things that are out there, including alcohol. It's something that has been shown to be much less addictive. It doesn't have addictive properties like nicotine from smoking. A person can become addicted to it, but when it's done with a therapist in a therapy office, the doses are not high enough and not often enough to be addicted, to be addictive. So there has been no research, there has been no evidence of people using it in therapy and becoming addicted to it. It's when it's used a lot more often that it becomes addictive. There's also a question that sometimes comes in, is ketamine is also used for pain relief. There are ketamine clinics that give IV infusion for people with chronic pain. So some people wonder, if I do ketamine treatment for my mental health, will it also help my pain? And that's very possible and needs to be discussed with your doctor. Sometimes that's like an additional bonus of just overall feeling better. The last thing I want to discuss is integration. It's a word that's often used when working with psychedelics. Not often explained though. So, as we mentioned before, ketamine enhances neuroplasticity. It forms new pathways in your brain, and it actually allows you to think a little differently than you thought before. But you have that on your journey, and what happens afterwards? How do you take that with you? So integration is the process of what happens after the effects of ketamine wear off, and is usually the second half of a ketamine session. And that is the process of reflecting of your journey, what you learned about yourself, and how you're going to take that with you. Sometimes people do different modalities. Like, it's an excellent time to do IFS because then managers and protectors are relaxed. You have an easier time accessing parts. Some people do EMDR. Some people do somatic work. It might be a little difficult if you haven't fully landed back in your body yet, but it's also something that could be done. So this process afterwards of taking what you learned and taking what you discovered and applying it to your life. Processing also continues for the next several days. People may have different thoughts, different feelings, or different dreams that can continue for a few days afterwards. So integration is not something that only takes place in the next hour or two, but takes place over time. So for many people, many KAP therapists will require a session the next morning just to be able to process everything that's come up overnight, to see how the client is doing, what they're experiencing, any new insights. And people very often find that as they reflect on their journeys, they're learning new things about themselves, or they're strengthening positive beliefs about themselves. So contemplating and applying what you learned is the process of integration. You're bringing this awareness and perspective into your daily life, and that is what leads to additional changes. Okay, that is all for today. Thank you all for listening.